Hi everyone, welcome back to my channel. I just got back from having my biopsy done. It was an experience. All the people were so kind and patient and just explained everything to me and my husband. And then once I went in, they explained everything step of the way. They held my hand. They were constantly concerned with how I was feeling, how I was doing, if I needed anything. I mean, just amazing. Just the sweetest, most comforting people. And that's the best you can ask for. It's like, it's a blessing to have that because it's obviously a very emotional and difficult time and thing to go through. Dr. LaRue was great. Amanda was great. There was another two ladies there that just the best. So it made it a whole lot more comforting and easy to swallow. Um, they took me and my husband into a separate waiting room, which is in the back towards where, next to the door in the room that they do the actual biopsy. And it was just these comfortable couches. It was like you were in your living room and lemon juice, water. And so they explained everything to me. I'm gonna switch hands here. Everything to me and my husband before I went in. And then I changed, took off, the bra and shirt and had to put on a gown. And then after she explained everything to me and my husband, then I said I need to use the bathroom because my nerves are shot. So I did, and she took me back and gave my husband a big hug and a kiss, and he just had the most encouraging, loving words for me. So we went in the room, and I actually sat on a chair. It wasn't like the Long Island medium where she laid down. I actually was sitting up, comfortable, but straight up in a chair. And oh my God, they just held my hand and explained everything, constantly concerned. And I really appreciated that. But they put the breast that they're getting ready to look at, they take a few pictures, just like if you were having a normal mammogram. And then they actually come in and put your breast where it needs to be. And they actually had me turn my head. Not that I'm afraid of needles. Needles don't scare me at all. They don't bother me. Um, but just so that they can have that whole area where my head wasn't in the way, they can have that whole area clear. And then I could focus on some beautiful pictures that were there. Sorry, trying to get comfortable here. And then they cleaned the area. They stuck in the needle, and I felt it. It's a quick, like, pick on needles, especially like when you have lab work done. No, this was different. It went in, and I felt it was like a long, like, stick. It wasn't like painful, but it was like, like shocking, like that, like kind of uncomfort real quick and shocking. Then that was okay, but it was just something that I had to just like close my eyes and just kind of grip her hand. And then it was kind of a little discomfort. I should say discomfort. I don't know, is it uncomfort or discomfort? Some discomfort, and when the numbing situation was going through, they were putting the numbing stuff in. It felt like pressure and a little discomfort. And then the rest was fine. And then they were taking pictures during the process as well. They would let me know, held my breath, all that good stuff. And then, trying to remember here. And then you could hear like a drill. And I think that's what I saw in the Long Island medium. And so it's kind of like, okay. And then pop. Like, I've never been shot. So I don't know what it's like to be shot. God forbid. I never have to go through it. But I've heard shots, and it sounded just like a shot. And you felt the pop and you heard the pop. So, whoa. And so I had to grip her hand again, kind of get through that little moment. It was like a moment. And maybe 30 seconds or less. And so that was pretty much it for the discomfort or any shocking. I don't really want to. Oh, there is some pain, just but a slight. I would call it more as a discomfort pain. I don't know if that makes sense. It wasn't a pain like you want to cry and you can't bear it, or like, oh my God. It was just like a shock, and then like, oh, okay, here we go. Kind of that. I don't know if I'm explaining myself. I'm trying to do the best to explain what it was like. And then that was pretty much it, except some clips here and there. But they were explaining to me each thing that they were doing. And then I guess they biopsied, got what they needed to get, and did their thing. And at towards the end, I kind of looked over out the corner of my eye, and I could see the pin marks that they did, and I could see where the needle went through. And there was some bleeding, not as much as I thought would be, unless they had cleaned it up and didn't tell me. But they kept pressure on it to kind of stop the bleeding, and then they cleaned it up. And then they took some more pictures after the biopsy was done. And then a couple of more, and I had to stand up for those. And then finally the doctor came and cleaned it up again and disinfected the area with alcohol. And then he put these surgical strips, and it was really, they're really tiny, really thin, really tiny, like a line strip. And he kind of formed like a starburst, which was kind of sweet. And then they put uh, like a soft, I don't want to say silicone pad, which is, let me see. I'm trying to show you. This pad right there is like the pad that goes on top. I'm trying to show you what a bro's heart. There's the pad. This is an ice pack. This round thing here is an ice pack, but it looks like that. And I can't show you the strips because I can't take this off. And then of course, they said that they would let me know in like 3 to 5 days. So hopefully by Friday, they said if they have the results by Friday, the person who did the biopsy, the doctor there, he will call me. If it goes past Friday, then my doctor will be calling me. So I'm hoping to God. I mean, I love my doctor to call me, but the sooner I get the results, the better. So I'm trying to find a comfortable spot, you guys. I'm sorry. Where I don't look crazy. So, yeah. And so that was it. And then they gave me some instructions. I'm trying to get them for you. Hold on. So they gave me some instructions here, and it says care after a needle breast biopsy. Let me see if the camera will focus. See if you can read that. And so, yeah, pretty much. And they gave me an extra ice pack. I showered this morning, thank God, because I can't shower tonight like I normally do. I shower in the morning and at night. So can't do that. I could like bathe my bottom half of my body, but I just have to really be careful not to get that area wet. And then tomorrow I can shower, but they still recommended not to get the area wet. And so just at least for the next 48 hours, I can't lift anything over 5 pounds. The strips, I have to let them fall off on their own. And pretty much the next 48 hours, I really have to just be pampered and kind of rest and not do anything. So I'm in my bed. Let's see if you can see that. I'm in my bed. watching some TV. And my husband bought me one of my favorite smoothies. And so they're just gonna really pamper me and make sure that I'm really, really good, and then I'm resting and stuff like that. So that means a lot to me. So far, my husband, he just went to run an errand, but my son is here with me if I need anything. And then probably my youngest daughter's in college, so she'll be home in the next couple of hours or so. And then my other daughter will most likely come visit me later on when she gets off of work. I'm going to kind of sit up a little bit because I have tendonitis in this left arm, and so it's kind of hurting from me laying on my left side. Oh, sorry. I always put my finger in the camera. Okay. This is my smoothie. It's called Peeling the Love. So good. It has strawberries, bananas, yogurt, all that good stuff. So yeah, so I went comfortable and I ate something before I went, and they wanted to make sure that I did. And I said yeah, and I told her what I had. She kind of laughed. I said it wasn't my ideal breakfast, but it's what I had in the moment, that I could not really do a lot to cook, but to make sure I had the filling, which I did 3 fried eggs by itself, and with a cup of milk, and then I had a little piece of bread, strawberry cake that I made last night, so that was good enough for now. And when I got out, of course, my husband got me my favorite smoothies. This is a large. It used to be called Twigs and Berries at Planet Smoothie, but the place is now called Smoothies Galore, so they had to change the name legally. So now it's called Peeling the Love. Sorry, it's so good. So, yeah. I'm like in my room with all my goodies. I have water, I have a fan, my books, and my planners and diaries, whatever I need, my chargers, my tablet. These are my wipes. I knocked my glasses down. Wipes if I need to wipe anything. I don't know why I have these Q-tips here, but Q-tips, always have some Q-tips laying around. Have my tablet, my laptop if I need it. My teddy bears from my husband's and my kids that I've collected. My Puerto Rico hat for my Puerto Rican people. Stuff like that. So, I've been in the mood for, sorry, my glasses. Sorry, my glasses fell down. But yeah. So, I'm sorry. That was kind of it. Oh, I gotta be careful. That was it. That was my experience with biopsy. I hope I never ever have to go through it again, even though I love the people that were there with me. I can't say enough good things about them. I needed their patience. I needed their sweetness. I needed them holding my hand and explaining every step of the way to me and just really being authentically concerned. I appreciate my husband for coming home from work to go. He came home, took a shower, and then we left. For coming and being with me on what is a very emotional and scary day, and for making sure I was good with my smoothie and stuff. So I'm gonna go ahead and rest. I just have to sit up. I can't lay down for some reason. Probably lay down in a minute when I don't have nothing in my hand. I'm done with my smoothie. Then I can probably just lay down and probably even get some sleep because I didn't sleep real good last night. Worried and nervous about this. I cried before I went into the actual biopsy room. I prayed before I went in, but then I also cried. And, you know, just meant a lot that my husband was there, and his hugs and his words, and then to have these wonderful people take me through. It was just perfect. And, you know, I hope nobody ever has to go through a biopsy. I hope I never have to go through it again. I hope everything comes out in my favor. But it's nice to have that if you have to go through it. So that's the latest update on my biopsy. It's over with. So all I have to do now is wait for the results, and God willing, those results are ready Friday, because I don't think I could go another week without knowing for sure my fate, or what's happening with me and what's the next step. So, okay. I might do another clip sometime later on, just to let you know how I'm feeling, see what symptoms have come up. They said there could be some more bleeding, some bruising. The anesthetic wears off 60 to 90 minutes after the procedure. I think it's been almost that. I can only take Tylenol. What else? Ice packing it. Some bruising is normal after biopsy. It may be present when you remove the dressing or may appear within the next 48 hours. It will disappear in a few days to a couple of weeks. For several days to several weeks, you may have some tenderness, twinges, and a little bump where the needle went into the skin. This can be bothersome, but it is not abnormal. Occasionally, a woman will experience, a bloody nipple discharge after the biopsy, as the small bruise liquefies and drains through the open breast ducts cut during the biopsy. This will stop after a couple of weeks. We would like you to limit activities and exercising for the next 48 hours. Do not lift anything over 5 pounds. Observe the biopsy site for any evidence of new redness or drainage after the procedure dressing is removed. Call the medical imaging department or your physician if you have an excessive bleeding, pain, fever, redness around the biopsy site. You will receive the results of your biopsy within 3 to 5 days. Please make an appointment in 6 to 12 months. We'll follow up examination. At that time, we will recheck the area where the biopsy was done. You may remove the parachute dressing and shower tomorrow morning. Do not loosen the steri strips. Keep them as dry as possible. You may shower bathe with the steri strips in place. However, do not submerge this area, bathtub, hot tub, or swimming pool, or let the shower strike right on them while the steri strips are in place. You may remove the steri strips after 10 days if they have not fallen off by then. So that's pretty much it for my instructions. And that's it for now. So I just wanted to update you that I have made it through the biopsy procedure and what it was like for me and stuff. So, yeah. Okay, I'm going to go finish my smoothie, get some rest, and I'll come back later to talk, chit-chat with you guys, that you know how I'm feeling in a few hours or so. Okay, thanks for coming on this journey with me, guys. I really appreciate it.